The esophagus, the way you can tell it is it just food passes through it, so you need a real hardy epithelium. This would be the inside of it right here. I'm going to kind of walk around the outside of it. See? All the way around the outside. This is that adventitia actually out here. Going all the way around. And so the inside, that would be the lumen. Okay? And this is a stratified squamous. You need a good hardy epithelium there. If you want to see the layers, this from here to here would be mucosa. This would be kind of submucosa. And then this is muscularis. It's not that clear on this one. But for sure, you know, you can tell that this is esophagus. Questions about this? There's a slide over there for stomach, and it actually has 3 different things on it because they show you 3 different parts of the stomach: the cardia, the fundus, and the pylorus. What the stomach has that's different than other ones is it has these. Let me see if I find a better spot for it. Yeah, this is okay here. Is you actually have pits that go into glands. So these are gastric glands deep in here. Let me find another one that's a little bit different. Yeah, here we can see the pits are going in, and these are all gastric glands in here, is what that is. Here's the third one. You can see a little more of the pits here, gastric glands shallower. This would be that muscularis mucosa. So this is all mucosa. This would be submucosa. And then these are the muscle layers. That would be serosa right there, that thin serous membrane. Okay? So that's stomach. Duodenum or duodenum, depending upon how you like to say it.
Duod.
This is the outside of it here, coming around. See how big it is? So this would be the inside of the lumen. And so what you see are these are villi. You see a lot of villi. Back in here, these would be intestinal crypts. This is in the submucosa, and those are those Brunner's glands. All these things in here. And that's how you can tell duodenum. You've got these Brunner's glands that make bicarb. And then this here is going to be muscularis externae. So let me show you another series of small intestines that has the duodenum on it. There's a slide like this that has 3 things on it. The small intestines we're going to see has 3 parts: duodenum, jejunum, and ileum. Okay. And so when you look at this, this shows you a piece of each of those areas. So this one, going around it again, all the way around, that would be the inside. These are those villi. And this is duodenum because these are Brunner's glands deep in here. And then this would be the muscularis externae. This is jejunum. It doesn't have Brunner's glands. It does have villi. Okay, these big villi. And then over here is going to be ileum. Has villi, but the way you can tell it's ileum, it has these Peyer's patches right here. About 4 or 5 of them there, or 6. So that's ileum. Colon is the next thing that we get to. The way you can tell colon, this is your mucosa. That's that muscularis mucosa. Is you don't have villi. See how flat it is? So that's what colon looks like. It's flat. You still have the crypts, intestinal crypts. Okay, so that's typical colon. That would be all submucosa. And then there's muscularis. So, and this part has adventitia on the colon. So that's colon, you guys. Questions about the bowel?
In our lab manual, it says that the colon has abundant goblet cells.
Yeah.
Did they show on that slide?
I didn't focus on it.
Can you show the jejunum? Or
Yeah, we saw that. That looks like the ileum, but it doesn't have the Peyer's patches in it.
can you hit that again?
So here's duodenum. Here's jejunum. So that's all mucosa, submucosa. We really don't see the muscularis good. This would be muscularis externa, and there's your serosa. And so you don't see those Peyer's patches.
Is that just how jejunum is? You can't see the muscularis mucosa, or is it just
No, not necessarily. I think it's just this specimen.
All right.
And there's ileum with Peyer's patches. Remember the pancreas, you guys?
Mm-hmm.
You had a lot of fun with that, remember? Well, it's back. So remember when you looked at it, you're really interested in these pancreatic islets. So now we're interested in the other parts of the pancreas. And so that other part of it is these acinar cells. So again, there's a pancreatic islet. We focus down around that. There's the islet. These are the acinar cells. And what these guys are doing are making digestive enzymes. Proteases, amylases, lipases, things like that. Okay, nasty, nasty digestive enzymes. And they secrete it into a duct. We're going to look at the ducts, the main pancreatic duct. Okay, and that then empties into the first part of the small intestines, the duodenum. Okay, now that trap you can find in ducts, and here's a duct right here. And the thing about the ducts are they also, those cells in the duct, they don't make digestive enzymes. They carry the digestive enzymes. But these cells in the duct make bicarbonate that's going to basically neutralize the acid.
Is that why you belch carbon dioxide from the neutralized carbonic acid? I think bicarbonate and doesn't bicarbonate and acid make carbonic acid, which dissociates the carbon dioxide?
Yeah, CO2 and water. Yeah, now that the enzymes that do that are going to be in the cells or in the blood cells. So you actually see that enzyme in a lot of different tissue. And so what this cell's going to do, what these duct cells are going to do is basically they'll go through that same reaction and they'll pump out the bicarb. And the hydrogen will stay in and go back in the blood. And so you actually, the end result of that is you're actually kind of producing acid, but then you take care of that a different way. You know, but the bicarb is getting pumped out into the duct. And then that's going to mix with the hydrochloric acid from the stomach and neutralize that. We'll talk about the pH of the chyme coming out of the stomach is like 1 to 2. And you've got to get it all the way back up to 7 to 8. Mm-hmm. And so the pancreas is making the bicarb, but we also saw the duodenum is making bicarb in those Brunner's glands to reduce that acid. So, we okay with this? What you got to do to be able to identify that this is pancreas again? You already got that down. Mm-hmm. This time, acinar cells and ducts. Okay. Liver. When you go get a slide for liver over there, the best one to get, it says liver pig. Okay? If you get liver pig, they stained it a special way such that you can see real easy these structures we want to look at. Okay? And so these things right here are called liver lobules. Okay? Liver lobules. And while you're up here close, I want to kind of draw this out because we're going to look at a liver model over there in a few minutes. Okay?
I thought you were a surgeon.
I don't have any fingernails. And I don't want to break it.
Maybe.
Open it for me. See, I'm not the only one struggling.
Just rip the card.
We're not going to rip it.
You want to give it to somebody else?
No.
See, it wasn't me.
Use your teeth.
There we go. No, I mean, it's hard being a teacher. You think it's easy, you know? You got to try to open chalk boxes.
That's why you got to upgrade to a whiteboard.
Right. No, actually, we prefer this.
Really?
Yeah. I know it looks like this, but it's actually, it's more fun to do. We use chalk and that other stuff. Okay, so a liver lobule looks kind of like this. It's six-sided. I know those don't look six-sided. And you'd have like another one here, you know. You kind of get the picture, right?
But a lot of people.
Okay. Another one going up this way.
Some people are. A lot of people.
Okay. So in the middle, it's like a wheel. That's the hub, right? Like on a bicycle wheel.
Yeah.
Okay. These corners, all these corners, okay, are called portal triads. And we're going to look at this when we go through the liver part coming up real soon. But I kind of want to just set you up for it. So what you're going to find in these portal triads are three things. That's why they're called a triad. You're going to have a branch of the hepatic artery, remember proper. You're going to have a branch of the hepatic portal vein, and you're going to have a branch, you're going to have a bile duct, okay? A bile duct. So you'll have these three things in each of these. And so what's coming is blood's coming into the liver through that fresh oxygenated blood from the hepatic artery proper that came from a branch of the common hepatic artery. There was a branch of the celiac artery that was a branch of the abdominal aorta. Good. Fresh oxygenated blood. Then the hepatic portal vein was where you collected that deoxygenated blood from the small intestines through the superior mesenteric vein, inferior mesenteric vein, splenic vein, and all that. And that fed into the liver. And that blood actually mixes, okay? And what it does is, let me kind of blow this up here a little bit. A little bigger. I know that wasn't that much bigger. But here's your hub. And so it's coming in here. Those are going to be there, those three things. And so the blood is going to percolate this direction towards a central vein. Okay, and along there are going to be little hepatocytes, liver cells. And they're going to take things out of the blood and put protein in the blood. Okay, and then all these central veins will then drain out through that hepatic vein into the inferior vena cava. So you're filtering that blood. At the same time, these hepatocytes, they will make bile, and they'll send bile back this way to the bile duct, and you're going to drain the bile duct out of the liver towards the gallbladder. So that's what you're seeing here. And when we get to the model, you'll look back at this and it'll start making a little bit of sense. The model that I'm going to show you in a while is going to be a section of this right here. And so it'd be like one of the spokes coming around. Okay? You follow me?
So the space in the middle of
This would be that central vein.
the central vein.
These out here in the corners would all be portal triads. Exactly.
And the hepatocytes are those little striations going.
Yeah, that's going to be all this stuff in here. And if we blow it up, maybe we can, talk to a hepatocyte.
Those lighter colored striations. Is that what they're? Oh wow.
These are all hepatocytes in here.
Yeah.
These spaces in here are what we're going to call sinusoids, like the capillaries. And so that's all. That would be the central vein right there. So these are all different hepatocytes.
So when you have hepatitis C, what does it damage? Just the tissue?
The hepatocytes.
The hepatocytes?
Yeah, it destroys hepatocytes.
Okay.
Yeah. And if it's bad enough, your liver will basically turn to cirrhosis, Okay, so what I want to do, you guys, is we have a lot of stuff to show you here. The best thing for me to do is show you all as a group rather than have you try and struggle through it. And then there should be time afterwards for you to study the different models while I grade your quizzes. So what I'm going to do is gather you around. I'm going to work off that second bench because it's a little easier to work off of.
Everybody kind of just just goes to the same spot they're always in.
Okay, so we're still on page 44. Now we're starting in the digestive tract, Roman numeral 2, mouth. A lot of this stuff you guys have seen already. So this is going to be a bit of a review. If you remember, in the mouth, the oral cavity here on the roof, you have the hard palate, soft palate, and the uvula. You guys remember those, right? We're okay with that? Remember the palatoglossal and palatopharyngeal arches by the palatine tonsil? Remember these two things right here? We just looked at that the other day. So we're okay with those? Everybody okay with that? Lingual tonsil, base of the tongue. Pharyngeal tonsil over here, and again, palatine tonsil. So, look at all that stuff you already know. And of course, you all know the tongue, right? Okay. Now, okay, so remember you guys, we have the oral pharynx back here, and the laryngopharynx, and the nasal pharynx here. That's down there on B. I just skipped the teeth for a second, because I didn't want to put this down and pick it back up. Okay, we okay with that?
Yes.
Okay, so on teeth, let me show you Mr. Tooth first,
Teeth.
and the different parts of it.
I thought we already learned teeth.
Crown. And this white stuff is the hardest stuff in the body, that's enamel. Okay? The neck of the tooth is right here. This stuff out here is the gingiva, which you call your gums. Okay? And then these are the roots. We okay with that? Underneath the neck, they have dentin written there, and that's this stuff here. Dentin. It's like bone, but it's not bone. Okay? The root, again here, see this white lining around it? That's the cementum. Okay? Pulp cavity, that's this stuff in here, where the blood vessels are. Periodontal ligament, that's this pink thing next to the cementum. Right there. That's the periodontal ligament. You didn't know you had ligaments in your teeth, did you? Yeah. That's why you hear about somebody that works as a periodontist. Yeah, he specializes in just this area. The root canal is this here, and this would be the apical foramen. That's where the blood vessels and nerve come in and out. Obviously, Mr. Tooth here needs a root canal. Anybody here had a root canal? They're fun. If Dennis ever says he wants you to have one, go to it, enjoy it. They basically just drill this out, kill this nerve, and they pack this up is what they do. Okay. We have a cavity here. It has gingivitis. That redness right there should be pink. Here's another cavity forming here. So Mr. Tooth is not doing good.
What's the difference between the apical foramen and the root canal?
This is all here is the root canal. That opening there is the apical foramen. Okay.
Why is there a color change? You know, people say they have like a dead tooth. It's like grayer than the rest of the teeth. Like,
I don't know why it's like that.
Okay.
Yeah, I don't know.
I was like, by dead is actually like something like dead with it? Is it no longer like that?
Well, I think what they're showing here is the fact that you've got an infected root. This whole thing's getting infected.
Okay, so that like
This would be what a normal root would look like.
Okay.
And that's how it would normal. So they're showing you an infected root with the pulp being infected.
Okay, so the pulp was died. That would.
Well, it's just the redness is just infected.
Okay, I was curious about it.
Yeah. But when they do a root canal, they drill those roots out. They wouldn't go into a tooth and just drill one root.
Yeah.
So if you're going to get a root canal, they're going to drill however many roots you have on that tooth. And then they fill it and pack it up with stuff.
Is that just to numb the tooth?
That's the only way you can get rid of that infection, to save the tooth. So you do that, and you pack it, and then basically you in essence have a dead tooth now, and so you are predisposed to more problems later down the road. This just shows you. We'll look at this in the lecture, and it shows you in your book. I only have one of these, and I kind of just keep it in my office. So if you really want to see it, come and get it from me. But it shows you have your incisors. You have central incisors, the first two, and the next two are lateral incisors. So these four are incisors. And then you have what's called cuspids or canines. You have one on each side. They're bigger than a dog, you know, or a vampire. Just the upper ones, though. Have you noticed that? I don't know why. Yeah, yeah. Okay. And then next are the bicuspids or premolars. You have two of them. And then you have the molars. You're supposed to have three, so we're missing one. So they must have had a wisdom tooth removed, the third molar. And so this gives you an example of those teeth. Okay, we'll look at that in lecture. Any question about teeth?
Which one's the premolar?
They're the same as the bicuspids. That would be these two right here,
Okay.
right after the canines, or the premolars. Next page, esophagus. Okay, one of the birds of the body, right here, on this guy. You see it right here, esophagus. Okay, so that's easy. Stomach. You should know the arrangement, you guys, of the abdominal cavity. Liver up in the right upper quadrant, small intestines in the middle, the colon kind of frames it, goes around the outside, and then the liver's hanging over basically the stomach, okay, this portion here, and then posterior there is going to be where your pancreas is, in the first part of the small intestines, the duodenum, okay. So we'll kind of walk through these things a little bit. Here's the stomach here. The things you need to know about it. This is where the esophagus is emptying in here. The area right around here is called the cardia. And then this portion that kind of bulges up here, you get an air bubble here. This is the fundus, just right in this area here. And then this portion from going from about here to about here is the body of the stomach. And then from here to about here is the pylorus. So those are the cardia, fundus, body, and pylorus. Those are the four different portions or different areas of the stomach. Pylorus actually is where you produce most of your acid. Okay. This here is the lesser curve. Down here is the greater curve. Okay. If you open this up, there's a muscle where the stomach empties into the duodenum. You can kind of see it right here. And that's the pyloric sphincter. It's a smooth muscle. Pyloric sphincter. And then these folds inside the stomach are called rugae. We're going to see rugae inside the bladder. Okay? So it's just not seen alone in the stomach. Rugae. I'll show you greater and lesser minimum in a second. Again, stomach. What curve is this? This one? This area right around here is the cardia. This here, fundus. From here to about here, body. And this is pylorus. And this muscle right here, pyloric sphincter. These ridges, rugae. Look at you guys, man. You're on top of this. Now, the stomach sits like this, with that transverse colon right below it here. Okay? Coming off of the greater curve of the stomach is an apron of fat that drapes down and comes down. They show it just half of it here. Drapes all the way down, comes back up and attaches to the transverse colon. This is called the greater omentum. The greater omentum. Okay? We don't have it on this model, but if it was here, it would go off of this greater curve, it would drape down, come back up, and hook to the transverse colon, and it covers the whole bowel like this. And we'll talk about what that is in lecture, what the heck it is. Now, on that, from the lesser curve, the liver sits over top like that, and you lift it up. On that lesser curve, there is a membrane that comes from the lesser curve of the stomach and attaches to the liver. And that's going to be the lesser omentum. Don't see it on the models in here. I will show it to you on the cadaver. Okay? And I'll show you the omentum on the greater omentum on the cadaver too. We okay with that? Okay, good. So, next we get into the small intestines, and you can see 1, 2, and 3. Those are the 3 parts of the small intestine: the duodenum, jejunum, and ileum, and they're in that sequence. Okay. So, as you can see, the stomach here is emptying right here at the pyloric sphincter into the first part of the small intestine called the duodenum. And if I take this off, what you'll see is that duodenum is C-shaped, and the head of the pancreas sits right in it. So this right here is duodenum. Okay? You can see it there, here, and right here. Okay? Now, just above that duodenum, you see that word plica circularis? What those are is to increase surface area in the small intestines. The mucosa, because of that muscularis mucosa, it contracts and it forms like a curtain, a plication, just like a curtain. And so you can see it right here. See those little round, and they're called circularis because they're in a circle like that. So that's all plica circularis. You can see it there. You can see it here inside of this guy. Here's some of it right in here. Okay? And you can see it right in here. Plica circularis. Under duodenum, common bile duct, main pancreatic duct, duodenal papilla. Best seen here. So here's the duodenum, the head of the pancreas. The pancreas is going to make digestive enzymes and collect it in this pancreatic duct. We'll look at this closer. And dump it into the duodenum right here. And so there's the pancreatic duct. This little opening here would be the duodenal papilla, where my Q-tip is sticking in. Duodenal papilla right there. Common bile duct joins this, and that's what this green thing is right here. It joins and hooks up with the pancreatic duct, and they both empty through that duodenal papilla. Okay? We're going to go back and look at this common bile duct in a minute, again, in that pancreatic duct. So, this now is going to empty into the next part of the small intestine called the jejunum. And the jejunum then empties into the ileum, and the ileum empties into the colon. So, with that said, as the bowel sits like this, okay, this would be the entrance here into the jejunum. Okay, that is basically where this is emptying right here. This sits like this. Okay, and so this left side, all the small intestines would be jejunum. And then it turns into ileum. There's not a point that you can see where jejunum turns into ileum. It's actually by the mucosa on the microscope. And it's also how the bowel acts and absorbs. So 80%, 90% of the food that you absorb is absorbed in the jejunum. The ileum now is going to be the more distal part that's going to empty into the first part of the colon. And so with that, with the same thing here, most of this on the left would be jejunum. Over here on the right would be ileum. Okay? Here you can see the entrance in the jejunum. So this for sure is jejunum here. This would be ileum emptying here. You can see right here the ileum emptying into the first part of the large intestine. It's called the cecum. And where it empties in there, this white represents the ileocecal valve. Cecum, ileum, ileocecal valve. Remember you had an ileocecal, ileocolic artery right here. Ileum, ileocecal valve. Did you run out of battery?
I ran out of space on my phone.
Oh, doesn't that suck? Okay. So we okay with jejunum, ileum, duodenum, and all that stuff? Any questions on that? Okay, large intestines. The first part of the large intestines right here is the cecum. It's actually part of the right colon. Okay. This here, the proper name for it, you can see there is written as variform appendix. Okay. And so in answering your questions on your lab practicals and stuff, you need to write variform appendix. Once you're done with this class, you can go back to just saying appendix. Okay? On this model, there it is right here. Variform appendix. And so what happens next is the stool that's emptied in here is liquid. It travels up the ascending or right colon, then goes across the transverse colon, and then down the descending colon or left colon, and then into, it does like a little S shape here, and that's the sigmoid colon, and then the rectum, and then finally the anus. Now, the colon has these like little pouches, and those are called haustra. Okay? So if I put a label here and ask you, what structure is this and what organ, you would say that's a haustra on the transverse colon. Okay? Now, tinea coli. Remember how I said that the external muscularis externa, the outer layer, is longitudinal? Well, in the colon, those collect as bands. And so that's what these stripes are. That's the tinea coli. These racing stripes. Okay. You can see them here, but they're just not painted. Okay. Tinea coli. Now, where the colon makes turns, the ascending colon converting into transverse colon makes this turn right here. It's the right colic flexure. They're called flexures. But the liver sits right here, so the other name for it is hepatic flexure. It actually attaches to the liver.
Which one do you prefer as to write?
Doesn't matter to me. I use hepatic flexure mostly. Now it comes across and it makes another turn on this left side, the left colic flexure, and what sits right here that attaches to is the spleen. And so that's why it's called the splenic flexure also on the left side. Again, you get down in the rectum and the anus. The anus, you have an internal sphincter that's smooth muscle, and that's what this would be represented. And then the muscles around here in the pelvic floor would make the external sphincter. Questions about this?
What did you say the tinea coli's function was again?
It's the longitudinal layer of muscle, so it actually is what it's what helps form those haustra. Is what it really does.
What's the
Okay.
function of the variform appendix, actually?
What's that?
What's the function of the variform appendix?
I was going to probably talk about that in lecture. I don't know if I cover it or not, but there's a lot of theories on that. Nobody really knows for sure. For a while, we thought it had an immune function in helping mature lymphocytes, because there's a lot of lymphatic tissue in there. One of the more recent theories is that it's a reservoir for your bacteria. So that if your colon got cleaned out of bacteria, you recolonize it with the right kind of bacteria. Would be one way of looking at it. The reason I really think is there is to help surgeons put their children through college. You know, which is a good enough reason for me to have it. Okay, so accessory structures. The salivary glands. The one on the masseter muscle is parotid. This one is submandibular, right underneath the mandible here. This doesn't show a sublingual one, but you can see it on this guy here. Right there. It actually, even right here, okay, sublingual gland. So those are the three salivary glands.
Where's submandibular?
Okay. Pancreas. The head is attached to the duodenum. In fact, you can't separate them. They share the same blood supply. You know, so if you have to remove the head of the pancreas, you got to take the duodenum with it. Body, and then tail. Main pancreatic duct, that's this one right here. coming down here and joining the common bile duct. And then, and that's also called the duct of Wirsung. And then this one right here is the accessory pancreatic duct. Empties in more proximal. The other name for it is the duct of Santorini.
That's at number 5.
I don't know. What's those things that they use in hockey on a hockey ring?
Zamboni.
Zamboni. Yeah. That was Santorini's cousin. Yeah. Okay, so we okay with that on the pancreas? Liver. The liver, you guys, is attached to the underside of the diaphragm by ligaments, and we'll look at them in lecture. They're called coronary. But the first one there, falciform ligament, okay, and then the bullet point, not the next one, but the one after that, round ligament and ligamentum teres, which were the same thing. We actually talked about the ligamentum teres in cardiovascular, in the circulation of the fetus. So see this thing right here? The liver sits like this, so the abdominal wall, the anterior abdominal wall would be like where my hand is. And so there's a ligament that attaches between here and the abdominal wall. It actually extends all the way out to your umbilicus. So if my umbilicus was out here where my finger is, that ligament would attach between here and the abdominal wall to the umbilicus. Okay? And on the underside of that ligament is the round ligament or ligamentum teres, and that was your umbilical vein. And as it came through, it then bypassed the liver. And so this white thing here is your round ligament or ligamentum teres. This here would be your falciform ligament. And again, that would continue out to your umbilicus. Okay? Right lobe, left lobe. And that's not technically right, but we're going to go with it because it's easy, and that's what your book does. Your book makes a big mistake on it. You know.
One more time, right lobe and left lobe.
Right? Isn't it the right side, left side? Use that falciform ligament to divide it. Okay? Hepatic veins, remember they drain the liver into the vena cava, and that was this one right here. Okay. Now, look over on the right there, you see porta hepatis. A porta is like an entry, like the port, okay? And that's the entry of how things are getting into the liver and how the bile is getting out. So this area right here is the porta hepatis. Okay? And in there, we have several structures. You guys have already looked at some of those structures. Okay? This blue thing here was the hepatic portal vein. Hepatic portal vein, remember that? That's bringing deoxygenated blood from the small intestines, but rich in nutrients to the liver. The red thing next to it was the hepatic artery proper. Okay? And then next to that is going to be these bile ducts. And notice that on these bile ducts, you have these ones that have the two branches there. So that's going to be right and left hepatic duct. That's draining bile out of the liver. The liver just made it. And it comes together to form this duct right there, which would be the common hepatic duct. And then that's going to join the duct that drains the gallbladder, which is the cystic duct, and we'll look at that in a minute. And it forms this duct right here, which would be the common bile duct, right there. Porta hepatis, hepatic artery proper, hepatic portal vein, and then this here would be your hepatic, common hepatic bile duct. I mean common hepatic duct. You guys got a lot of hepatics going on, don't you? Okay. So, I'm going to kind of take you into the next part of this. Before we do the liver model, skip down the gallbladder and common bile duct. Okay. So, the liver sits like this, the gallbladder's hanging onto it. Liver makes the bile. When you're not eating, the bile backs up into the gallbladder where it's stored and concentrated. when you eat a fatty meal, there's a hormone that stimulates the gallbladder to contract, and the bile then goes down and empties into the duodenum. It mixes with fats and helps you digest fats. Okay, so with that said, this was again the common hepatic duct, and the duct that drains the gallbladder is the cystic duct, that duct right there, the cystic duct. When they come together, they form the common bile duct. Okay? Common bile duct. The cystic duct and the common hepatic duct come together to form the common bile duct. So look at it on this model here. What this represents here is a piece of the liver with the gallbladder attached to it. Coming out right here would be the bile coming out of the liver through the right and left hepatic ducts. These two right here. The right and left hepatic duct. They form the common hepatic duct right there. Okay? The gallbladder empties through the cystic duct right here. And then that together with the common hepatic duct forms the common bile duct right there. The common bile duct then empties, goes through the liver, you see it, through the pancreas right here. And here it is here, common bile duct joins up with the pancreatic duct. Okay? What you want to do is, on a piece of paper, to practice, figure this out. I'm just going to erase that part right there. Is just draw it out. Okay? Coming out of the liver. Okay, this is liver. Would be the left hepatic duct, right hepatic duct. Forming what? Common hepatic duct. Okay? This goes back up here to the gallbladder, cystic duct, common bile duct. This now comes into the pancreas. This is the duodenum, and this common bile duct joins up with the pancreatic duct, the main pancreatic duct, and empties into the duodenum here. A lot of dust. Huh. So, practice that. Draw those out. Okay? Questions about that? Okay with it? Okay, back up on the liver model. Remember I showed you that that's just that section of the lobule here, and here it is right here. Okay? And so, this blue right here represents that central vein. This over here would be one of those portal triads. So what that means is you got a portal triad here, you'd have another one here, another one here, another one here, and over here. And so this would be like a big liver lobule. We okay with that? So, through that porta hepatis, you brought blood by the hepatic artery proper, the hepatic portal vein, okay? And so they're going to come down, and these are what's entering these portal triads, because there's three things here. This here would represent a branch of that hepatic artery proper. This blue would represent a branch of that hepatic portal vein. And what they do is, their blood actually mixes together, and it percolates through the liver, and these are called sinusoids. These are even leakier than capillaries. In fact, they really don't have much of a wall. And then they collect in this central vein. Along the way are these hepatocytes. That's what these brown cells are. And they're taking things out of the blood and putting things back in. So, and they also are making bile. And that's what these little green things are. These are bile canaliculi. The bile is being made, and it goes back this way and collects in these bile ducts. all those bile ducts collect and come out as the right hepatic duct or left hepatic duct, which then form the common hepatic duct, so forth. Now, this blood that percolates through the central vein, all these central veins start collecting together, and they drain out the liver into the vena cava through the hepatic vein. So, one way of looking at it, blood's entering the liver through the portal hepatis, through that artery in that vein, and it's draining out of the liver through the hepatic veins. Okay, bile's being made in the liver and coming out through the portal hepatis into the common bile duct and hooking up with the cystic duct. So on this again, portal triad, central vein, branch of the hepatic artery proper, branch of the hepatic portal vein. This is a bile duct. Hepatocytes in brown, bile canaliculi. This blue in here is sinusoids. This is your central vein. Okay? Questions about this? We only have one of these models. It will be at a station. There will be 3 questions on it. Fair enough?
Awesome.
What did I miss?
This summer we'll write a song inspired by you. Thanks.
No, I didn't miss that. So, hepatic. You can make a little song out of it. Hepatocytes, hepatic portal vein, hepatic artery proper, hepatic vein, left hepatic duct, right hepatic duct, common hepatic duct, hepatocytes. I mean, there's a lot of hepatis going on here. Okay? So, try not to confuse your hepatis. Okay? Any questions? How much time you guys got? 15 minutes. I'm going to try and get your quizzes graded real quick, okay? You guys can grab any of these models and start looking at them.